1027, 1035 WICY, your feel-good favorites from the 80s and more. I'm John Kazar. We have Jennifer Shull joining us from Alice Hyde Medical Center. She is a pediatric nurse practitioner there. Jen, you're with us, it seems, every few weeks now lately because there's just so much changing, isn't there?
Absolutely, so much.
Yeah, and one of the things we're going to focus on today, there's a few topics. We'll begin right here. Allergy awareness in kids.
You know, we just had our first beautiful weather weekend, and unfortunately, we're all struggling with our seasonal allergies right now. But kids, we need to focus on what we can do for them.
Yeah, I think that's very important. Treating your child's allergies, where do we start?
Well, I think the biggest thing is to know there are several kinds of allergens at work right now. Some kids get their relief just by eliminating what they're exposed to if we know what it is. That might mean closing your windows, using the AC, staying indoors when the pollen count's really high. Big things. We've said this so many times. Washing their hands, showering, changing out of the clothes after they've been outside. If these things aren't really helping these symptoms, give your pediatrician or doctor a call and talk those through. We might have to see an allergist or somebody like that to, figure out what that specific allergen is.
Sure. Things for parents to know. I'm sure there's a few.
As a parent with a kid that has allergies, we struggle to figure out what is going on. So those pollen counts, if that's grass, mold, dust mites, whatever it is, try to keep that stuff out of your house, which you might have to vacuum 1 or 2 times a week to help get that stuff out of your carpet. Use a HEPA filter if you can. Keeping the air clean by using your air conditioner with a nice filter on it. Dust with a damp cloth versus, moving that stuff into the air. Cleaning your shower curtains of mold. And washing the sheets on the bed in high hot water and high heat every week.
Yeah. All this stuff is so important. Allergies in infants and toddlers specifically, Jen.
So believe it or not, babies can have allergies just like older kids. It's just harder to figure out sometimes because they can't really tell us what's going on. But there's 3 typical categories in kids: food and medicines, environmental, and then those seasonal allergies. And they can be anywhere from mild to severe. If they're severe, obviously, get them the medical attention they need as soon as possible. If they're mild, kind of come and go. Just keep an eye on what's maybe changed in your kid's environment. Did they try something new to eat? Did you guys switch detergents? Did you interact with a new pet? And again, when in doubt, call your doctor's office. We're more than happy to sit down, chat with you guys, and help you figure out what we can do to make our kids feel better.
Absolutely. Jennifer Shull with us, pediatric nurse practitioner at Alice Hyde Medical Center, our weekly update out of there. And Jen, anything else you want to add?
No, I hope everyone enjoys this beautiful weather while we have it.
Yeah, everyone thinks it's going to be short term. I guess we've just been scarred in the past, but I think maybe we could be, no such thing as smooth sailing all the way, but I think we're going to be pretty good here. I don't know.
I sure hope.
Thanks again, Jen. We'll talk soon.
You're welcome.
Inside the community, it's an update out of Alice Hyde Medical Center right here on 1027, 1035 WICY.